So recently on a video, I had talked about Cannabis Hyperemesis Syndrome, or otherwise known as in the news, Scromiting. And when I released that video, I immediately got people saying, it's a real thing, it's a real thing. In fact, even my wife, who I said in the video works in an emergency room and sees CHS patients come in, my wife said, it's a real thing. Never once did I want to ever downplay the fact that it's not a real thing. What I was simply stating in the video is the fact that the news often over sensationalizes, like, duh, we all know that. So where I'm going with that is that I wanted to get some real information and education about what CHS is, Cannabis Hyperemesis Syndrome, and I wanted to get that information to you guys. So I contacted Dr. Quinn Snyder, who has been a guest on my podcast speaking about his ketamine therapy clinic in the past. But above and beyond that, he is an actual practicing medical doctor in emergency rooms here in the Phoenix metropolitan area. So he actually sees patients, treats them, and knows what he's talking about and has the qualifications. I went down, I interviewed him, and got some information to bring to you guys about what is the facts on what CHS is, what he's seeing in the emergency room, how they're handling it, what the patients are looking like and presenting, and then what people can do to not, or who are experiencing CHS, what they can do to mitigate those symptoms. So thank you so much for tuning in. I sincerely appreciate Dr. Snyder for allowing me to come down and interview him and have these conversations and bring you guys the information. So let me know what you think. If you like, you do the whole like and subscribe thing if you're getting something out of this. And again, I'm just trying to bring you guys good content and good education from the actual people taking care of this, not some news media propaganda BS. So have a listen. Let me know what you think. Take care, everyone. All right. Hello, everyone. This is AJ with the Blue to Green podcast. I am here with Dr. Quinn Snyder, who has been a guest on our podcast before. And I'm here today to talk with him and have him give a little interview about what it is that we're seeing in the news articles regarding what vomiting or scromiting is, or, all of that sort of stuff. So, Dr. Snyder, if you could just please just give us a little background as to who you are and what your qualifications are, please. Sure. And then we can move on to what is this big scare tactic that's happening with the propaganda and the news and all that. So please, by all means.
Awesome. Thanks, AJ. Thanks for having me again. My name is Quinn Snyder. I'm an emergency physician, board-certified emergency physician. Been working in the Phoenix metro area for over 15 years now. Working at some of the top hospitals in the area. I've definitely seen a lot of patients on pretty much all sorts of intoxicants that you could possibly imagine. Everything ranging from cannabis through PCP and everything in between. So seeing all the complications of pretty much any drug you could possibly imagine at this point. And yeah, there's a lot to it. There's a lot to unpack, I think, about pretty much every substance and all the different kinds of intoxicants. And some of them, a lot of, I think there's a misconception that, like, pretty much there are certain drugs that everybody thinks might have no medicinal properties whatsoever. But pretty much almost every drug that you encounter has medicinal properties that are really relevant, that are really important to understand. But along with those medicinal properties, there come side effects, obviously, and you have to manage those. So, cannabis is first and foremost a drug that has a lot of properties that are recreational for some people, obviously, but are also very therapeutic and medicinal, clearly, for many people. So cannabis, in particular, obviously has great efficacy against epilepsy, MS, muscle spasms, chronic pain, is an anti-inflammatory. Still, trying to understand how it works for some people in terms of as an anti-anxiety medication or antidepressant and whatnot, or for PTSD. There's some mixed data out on that. However, in terms of the side effects, there's this question about what is cannabinoid hyperemesis syndrome, or as some people call it, scromiting. So why do they call it scromiting? Okay, so scromiting is short for scream vomiting. Okay, so screaming plus vomiting. And the truth is that there is a subset of individuals, and most of them are people who have been using cannabis pretty much every day at extremely high doses. And we're not talking about, up to 1 to 5 milligrams per day. We're talking about people who are using 50, 100, 150 milligrams per day of the substance. And then for whatever reason, and sometimes they may have been using this substance for years on end, for whatever reason, there's a day where all of a sudden they start having intractable vomiting. And it looks absolutely miserable. Not gonna lie, looks absolutely miserable. They seem to not be able to stop throwing up. This can go on for hours on end. they look incredibly uncomfortable, truthfully. And oftentimes they may be presenting in a fashion where they're relatively dramatic even. And that's where kind of the screaming comes from. At some points, you can even hear the patient before you even walk in the room, that they're screaming and seemingly vomiting uncontrollably. As an ER doc, when I walk in and I see this, the first thing I want to do is say, how can we help this person? Obviously, because they look miserable. Luckily, we have very good drugs that can typically terminate the symptoms of cannabinoid hyperemesis syndrome pretty quickly, actually. In my practice, I've found that droperidol or haloperidol, which are actually atypical or typical antipsychotics, work extremely well. So between that and providing IV fluids to rehydrate the patient, oftentimes we can terminate cannabinoid hyperemesis syndrome symptoms within an hour or two. Vast majority of the time, these patients don't need to stay in the hospital. They can go home and they can rehydrate in the days ahead. But there is this issue where, yes, like you have to stop using the drug in those quantities and in that frequency that you had previously been doing it. And for some people, that means total cessation is the only option, okay? For other people, that means that there probably is some lower threshold than where they're currently at in terms of the frequency, as well as the amount that they're using, that they can still comfortably use cannabis and not experience the symptoms of cannabinoid hyperemesis syndrome, which, as I said, look very uncomfortable, truthfully. Yeah, it looks not great to have cannabinoid hyperemesis syndrome. But, in terms of the total number of people who are getting this, I mean, it's actually very few. I mean, when you do the math, it looks like probably something in maybe 0.1, 0.2% of people will develop cannabinoid hyperemesis syndrome as a result of using cannabis at high doses and at high frequencies. And I'll just say this, in my clinical practice, what I noticed was that until medicinal marijuana became more readily available here in Arizona in particular, we really weren't seeing that much of it. So I really do think that having a significant increase in the dosage and the frequency of the drug for individuals really has kind of changed that calculus. And I'll say this too, though, before that happened, we often saw people, and we still do see these individuals with two different classes of vomiting syndromes as well. There's cyclic vomiting syndrome as well as diabetic gastroparesis, which is also very common, where individuals vomit intractably and need to be seen in the ED and even hospitalized at some points. And I do suspect that there was kind of a subset before medicinal marijuana came around where people were exhibiting cannabinoid hyperemesis syndrome, but we just didn't know it. We didn't know that it was actually cannabinoid related. But, vomiting syndromes in general are, they're not new. They've been around for a very long time. And yes, I do believe that kind of changes in the frequency and dosage of people's cannabis consumption will result in fewer of these visits. Now, like our EDs, across the country, like overflowing with these patients and like we can't manage it or anything. No, it's not the case at all. We can definitely manage
So
it.
the news media has been a little propaganda-ish, I would say.
I'd say it's probably
My words, not yours.
I think in all likelihood, people probably are overinflating what's actually happening out there. But part of that may be due to the fact that it is kind of a dramatic presentation, so to speak. So that always changes how people look at things, I'd say.
Regarding demographics, are you noticing anything in the younger crowd, the older crowd, male, female, anything in relation to that's noticeable or distinguishable?
It definitely seems more the younger crowd. Absolutely. There's definitely a lot more younger people that seem to get it, I'd say in their 20s and 30s typically. But it's, almost always high dose, high frequency cannabis users. There's also this issue too, though, where some people will stop using cannabis and the symptoms will still continue. And sometimes it can last for weeks on end even. But what we found is that there are a couple things that actually do help. A lot of people will take hot showers, actually. Hot showers seem to help. the symptoms overall. Also, capsaicin cream will help as well. So there are some options to try to kind of treat this at home. But truth be told, when it gets really bad, yeah, you probably need to be seen in the ED. But look, I mean, there's a myriad of different things that people do to themselves, and things that happen, the side effects of different medications and whatnot, that we frequently see people in the ED for all the time. And if if this medicine, that's something that they're using, which is really important to them and is treating a condition, and this happens to be a side effect, then there are adjustments that can be made, I think, to make it more comfortable, and for the not just the medicinal, but even the recreational population as well. Yeah.
Are you seeing a difference are you asking the questions of, again, I know I'm getting into kind of the weeds in regards to what products people are using.
Yeah.
So is there a difference between those who are using the flower, those who are using the concentrates, or using the vapes or anything like that? Are you guys collecting any kind of data in that regard?
That's a good question. It seems to be individuals. Truly, it seems to be individuals who are more doing edibles. Actually, is what I've seen. Because the dosage can be so high with individuals who do take edibles. I mean, not uncommon to take like 100 milligram edible, obviously, and then that can kind of cause more vomiting. But I don't know. I've definitely seen people who have been using vape pens, who've been not as much like just straight flower, to be honest with you. And I do ask these people. I ask them, what they have been using. But yeah, I'd say that the concentrates are probably much at higher risk. I mean, look, it's all about higher dosage, higher frequency. Yeah.
Gotcha. So what are some suggestions for the young people, for the people that are experiencing this, or they're gonna see this interview, but like, again, the propaganda, the scare has been like, oh, I'm gonna smoke weed one time, and next thing you know, I'm gonna end up in the hospital. So is it just about the usage in moderation?
Yeah, absolutely. I mean, this substance can obviously be safely used in moderation for the vast majority of people. And I mean, using cannabis once is not going to cause cannabinoid hyperemesis syndrome. If you do use cannabis, though, frequently, at high dosages, absolutely, that risk is real. However, for the vast majority of people, yeah, I mean, they can safely use cannabis, not going to send them to the hospital. There's literally millions of people using cannabis every year, totally safely, not ending up in the hospital. Is it something that people should be aware of? Absolutely. I mean, it's a real thing. There is no doubt about it. I mean, I have seen it many times in my career, but is it something that can be addressed the vast majority of the time safely, within a hospital setting? Absolutely. Yeah. There was one other thing I thought was worth mentioning too. There is this interesting phenomenon that occurs when people have cannabinoid hyperemesis syndrome, where some people, they're just kind of in denial about the fact that, look, it's the weed, okay? Like, if you're vomiting nonstop and you smoke and use very high dosages of cannabis and you're doing it very frequently and you're vomiting uncontrollably, it's the weed, okay? Like, let it go. It's okay. You're not a bad person, okay? That has nothing to do with it. There are treatments for it, and there are ways out of it. So it's very important to understand that. Just let that go. Find the best pathway towards healing and figure out the plan to make that go away. You do not want to live with scromiting. It is terrible, okay? It's not what you want to deal with. And in terms of how frequently we see it, yeah, I've seen it numerous times. Depending upon the hospital, depending upon where you're at, it might be something that you might see once a week. It might be something that you see once a month or once a quarter, depending upon other hospitals. There are probably places on Earth where they might see it even every day, possibly in the ED. But in my career, have I seen it a bunch? Yeah, I've seen it plenty of times. Trust me. And but it's one of those things that for me as an ED doc, it's nice to get to deal with because I know I can treat it. I feel very comfortable treating it. And almost every ED doctor all across the country knows exactly how to deal with this problem. So don't be embarrassed. Trust me, we've seen it all. There are plenty of other things that people have done to themselves, which are probably far more embarrassing, which we still don't care about, okay? Which we still don't care about because we're ED docs and we're here to help you. Thank you.
Real quick, just one of the things, obviously, like, is there dangers of having cannabis hyperemesis other than the fact of dehydration from vomiting? What are some other just risk factors if you do have it?
I mean, that's really what it boils down to. It boils down to dehydration, as well as, you know, the potential for electrolyte abnormalities, or the potential for having acute renal failure, meaning your kidneys start to shut down because they're not getting adequate fluid flowing through it. But I mean, we're talking, that is like a microscopic number of people who end up needing to be admitted to the hospital because they vomited so much that they can't control it. Because the reality is, the majority of the people who do get it, they're usually younger people, and they usually have fewer medical problems. They're not as high a risk. And yes, I don't understand why, but it doesn't seem to happen as much in the older populations. I mean, once you hit 40, 50, you really don't see it that much. You're not really seeing a lot of people in those populations. And that may be because of consumption patterns, maybe due to physiology. We just don't really know. But a lot of older people, yeah, they didn't grow up with using, you know, hundreds of milligrams of THC at any given time while they're using cannabis. Instead, you know, yeah, they're just using far less. So look, it's safer. It's safer to use less. I mean, you know, you want to maximize the therapeutic benefit with a minimum dosage generally with whatever substance you do. So at least, you know, I think most people feel that way. Yeah.
And I would say that most of the, just in my personal experiences, most of the younger generation are the ones who are using the higher concentrate waxes, vapes, and all that. And it's the medical patients with cancer and such that are using the higher dose edibles. But that older generation, that's kind of the old hippies that are smoking flower for the most part, that you're probably not seeing. Again, this is a speculation on my part that you're not seeing those types. A little older, that frontal lobe is a little bit more advanced, and, you know, we have a little bit more impulse control the older we get. So.
Yeah, no, I think that's all true. And, you know, especially for cancer-related nausea and vomiting syndrome. And so that's another thing about this too that's so fascinating, right? Because, like, here is a drug that is one of our best anti-nausea drugs that exists, right? I mean, like, this is a drug that you can inhale that can result in significant improvements in cancer-related nausea and vomiting. Okay, so for that population, yeah, it works amazingly well. I mean, there are preparations, I believe, which are even FDA approved for this indication. So to have that, you know, juxtaposed with this other kind of form where all of a sudden the switch is totally flipped and people are vomiting uncontrollably instead, it's very bizarre. I can't really think of a drug where it treats something so specific like that, and yet that ends up being the side effect as well. It's a very unusual combination, but yeah, could be age related, could be dosage related, could be physiology and just generally what's going on in someone's body. Just hard to say. Yeah, and it is unpredictable. I mean, it's just hard to tell. I've definitely seen women, men with it. Yeah, I don't know, but it's real.
and that was the thing that we wanted to dispel. I had said in a previous video, and I didn't ever want to downplay it. And, you know, I didn't want to ever say, no, it's a real thing. I know it's a real thing. I said, that's why I appreciate coming to you and getting the real information. So again, thank you so much, Dr. Appreciate it.
For sure. Thanks a lot, AJ.